Hi everybody, my name's Jasmine and I am an aesthetic registered nurse. So today we're going to talk about how to become an aesthetic nurse, how to apply to positions to become an aesthetic nurse, what it's really like to work as an aesthetic nurse, and how to stand out when you're applying. So what is an aesthetic nurse? This is a nurse who performs cosmetic, non-surgical aesthetic procedures. I'd say the core of what we do comes down to injectables, which in very blunt, blatant terms is Botox and dermal fillers. We may also do other skin treatments like microneedling, laser skin resurfacing, medical grade chemical peels, and a lot of other treatments that involve the skin. Now I want to clarify, an aesthetic nurse is doing a medical procedure. Typically this does not involve what the scope of practice of an aesthetician does, which would be facials, even medical grade facials. And we also don't typically do eyelashes, microblading of eyebrows, or other cosmetic non-medical based procedures. So really quickly, we're going to talk about how I became an aesthetic nurse, and this is not the core of this video because this is typically not going to apply to anyone who just wants to become an aesthetic nurse. So my mom is actually an aesthetic nurse practitioner, and she's been practicing since I was about 5 years old. So ever since I was 5, I have been around Botox and fillers, and these are all very normal things for me. In high school, I didn't really think I was going to pursue nursing or even aesthetics, and I didn't even know how cool it was until I got my lips done. But at the age of 15, I started working with my mom. I started working in the front, and then before becoming a nurse, I was performing body contouring procedures that did not require a medical license. So I learned a lot about body contouring, and then after high school, I went to nursing school, and then I became an aesthetic registered nurse. So obviously not everyone's going to be able to take the same path as I did, so I want to share some tips and a reasonable timeline of how you can become an aesthetic registered nurse. So before you decide to commit yourself to becoming an aesthetic nurse, I highly recommend that you go out and shadow. You see what it's like to actually experience aesthetic nursing. I think very often it's not exactly what we think it to be. I've even had friends who've taken on interns who after a couple days decided, you know what, this isn't for me, and that's completely okay. So that's why I think it's really, really important to shadow and intern and get that experience before you commit yourself to that path. I also want to let you guys know that to perform the procedures that I do, you don't have to become a nurse. There are other paths that you can take, such as PA, MD, or DO. So the state that you live in dictates what medical license you need to have to perform these procedures. So I would heavily recommend doing some research to find out what your state requires. So when it comes to legalities, very often I'm going to be talking about the state of California because that's what I'm most familiar with. So in the state of California and many other states, you have to be a registered nurse. Now, very often this is a bachelor's, but sometimes you actually don't have to get your bachelor's. You can get your associates and get your registered nurse license by taking the NCLEX after. So if you're absolutely sure that you want to be an aesthetic nurse or even just a nurse, let's talk about really quickly how to get into nursing school. So me personally, straight out of high school, I went straight into a nursing school. It was a private with my GEs or my prereqs. It took me 3 years total, but there's a lot of other paths to get into a nursing program as well. I know that, so California, if we're talking about Cal States, these nursing programs are a little bit more rigorous to get into. I wouldn't even say a little bit, they're a lot more rigorous to get into. So very often people will have a 4-year bachelor's prior to going to nursing school. Now we can say if your nursing program's 4 years and your bachelor's is 4 years, this is the same time that it's gonna take to get into a PA, maybe even an MD program, but there's a lot of different ways that you can get your nursing license. And if we even talk about associate's degree, that's typically a lot less of a time requirement than a bachelor's. But again, I would recommend getting your bachelor's. It's a little bit more smiled upon, especially as a country, we're trying to advance our degrees a little bit more. There's a lot of other YouTube videos on how to get into nursing school and how to become a registered nurse or how to get your bachelor's of science in nursing. So I'd recommend go watch those videos. So yay, you got into nursing school. Now we need to pass our NCLEX so we can get our RN license and practice in the state of California or any other state that you're in. Sorry, Rhode Island, we just got that revoked. If you currently are in nursing school, now's a great time to start getting your shadowing experience or even your interning experience. You can also use this time if you're not working and you want to work in nursing school, which is really difficult to do. You can get a job at the front desk, find out if there's a position for you to be trained in body contouring or cool sculpting or even social media manager. Personally, I started working with interns and volunteers, and in return for shadowing, which is very valuable experience that people pay thousands of dollars to do, they can help us out with our social media, mostly Instagram posts, and will allow them to shadow for free. But not a lot of places offer this, so I'd recommend going to a facility that you greatly admire and asking them if this is something that you can do. And don't just ask them, hey, can I shadow? Can I intern for you? You have to approach it like, hey, I can help you greatly in your business, and I want to help you expand and grow your social media so you can get a lot more patients, and I think that this is the path for me, and I want to see if I can shadow in return for free business help or something of the sort. And really quickly, let me throw in there that if you are in nursing school, you're not going to learn anything about aesthetic nursing in nursing school. Nursing school focuses on bedside nursing, or even sometimes you get to rotate on specialized units and learn about specialized units such as peds, OB, mental health. There's a lot of other nursing paths that they focus on, but aesthetic nursing is not one. I know that Allergan is trying to push for aesthetic medicine residencies, but this is more so for MDs or maybe even DOs. I don't think I've heard about them expanding this for nursing, just so you know. So congratulations, you took the NCLEX and you passed. You now have an RN license in your state that requires an RN license for you to practice Botox and dermal fillers, or all the other treatments that we really briefly mentioned. Since we're talking about the state of California, you cannot practice as an aesthetic nurse by yourself. You need to have an MD in your practice, and you need to have a nurse practitioner perform a good faith exam or a medical clearance for the medical prescription of something like Botox or even fillers. They need to be medically cleared, so you can't practice on your own. Or if you're in Rhode Island and you can't inject whatsoever, you do need to get your nurse practitioners, which is your master's. Again, a lot of videos on these different nursing paths, go check those out. So now that you're applying for jobs, you need to look for jobs who are going to take you in. If you are a new grad nurse, very often a lot of facilities do not want to spend the time to train a new grad nurse, which yes is frustrating, but there's a lot of ways to go about this. But guess what? If they don't want to train a new grad, then you don't want to work for them. So let's look at it that way. Just understand that this is a business decision by the business owner or whoever's hiring, that they do not have the time to invest in training a new grad. It's not about discriminating. It's just about, hey, we don't have the resources to train right now. We need someone that is trained. Medical aesthetics is a business. It's very different than bedside or other fields of nursing where you really don't need to take into account the business aspect. And I would argue that even working in a hospital, you do have to take into consideration the business aspect of what you're working with, what you're working for. So if you don't have any prior experience shadowing or interning, it's going to be a lot more difficult to get your foot in the door. Very often what people do after graduating is they pay a couple $1,000s to take a Botox or a filler certification course, and then they go apply, but you're going up against people that have experience. Even if it's someone who shadowed, if it's someone who has shadowed me and I have taught them from the beginning what I've learned over the course of the years, I'm likely gonna hire them even if they don't have those certifications, because they can get those certifications in my practice compared to someone who just has the certifications but doesn't have experience. So if possible, don't take those certifications prior to getting hired. Do this as a last resort. As a new grad, typically the people hiring new grads, and this is not always going to be true, but you're going to more easily be hired into a large chain med spa corporation. I've heard of a lot of friends working for these types of clinics, and even people I don't know. Patients will come in and say, oh, my cousin worked for, this facility and she really didn't like it. It just was very fast paced and they didn't value the patients, or it was just the same thing over and over. And these are typically, I wouldn't call them lower quality, because I think that they can offer good quality treatments depending on what that is, but you really want to try to apply for a facility that's really devoted to advancing practices and advancing you as a nurse. Again, I would also refer to this as a last resort. I'd say in a perfect world, if you could go out there and find your dream provider, oh my gosh, Bellevue Medical, they're the best med spa I know, or medical aesthetics clinic that I ever know. I really want to work for them. Let me apply to see if I can shadow. Let me try to intern. Let me offer them free help for their business and see if I can get a foot in the door that way. And if we don't do that, we'll talk about tips on how to make your application shine. So to perform these procedures that we talked about before, you don't have to work in a med spa. You can work under a plastic surgeon, you can work under a dermatologist, you can work under a derm PA, NP. As a matter of fact, I know people who practice injectables in their OB and even peds facilities. Now it's very different. One time I even went to an urgent care and they said they offered Botox, not for non-cosmetic, but they were definitely offering like Botox for forehead wrinkles and things like that. So that was very interesting. That's probably not where I would get my Botox, but maybe people have great experiences there. So while we have this little break in between applying and how to make yourself stand out, I want to talk about what it's really like working in the aesthetic nursing industry or the cosmetic medical aesthetics industry. And specifically, we're going to talk about the downsides. Now, first, let me tell you, this is the beauty industry. So when we're talking about beauty, there's going to be drama. I'm sure at Sephora or Ulta, the nice ladies and awesome men who work there run into some drama too. That's kind of just how beauty is. If you've ever been on a cheer team, I personally wasn't on cheer, but that's how I would compare it to. So it's really important, if possible, that you can find a work environment where everyone working there is really nice and helpful and encouraging. That would be a perfect world. But again, this is the beauty industry. Another downside, and I've heard of this a lot from the people that I work with who have worked in other facilities, is that there may be more advanced practitioners that are very ego-driven or power-hungry that you have to work under, especially if you're working, for example, just under a doctor and they want to take the fun procedures. For example, they want to inject and they want you to just do the lasers, or they don't care to advance you as a practitioner. Again, it's about ego, it's about power, because this is the beauty industry. I would also call this a downside. In my opinion, I'm not super huge into putting on makeup. I really like a nice clean face. But again, beauty industry, you have to go to work, you have to look nice, you have to look more than presentable, because you are talking to people about beauty. And if that's not something that you reflect, I don't think those patients are going to trust you in their treatment process. Another downside to cosmetic or aesthetic nursing or the aesthetic practice as a whole, it's very social. You have to talk to your patients. You have to befriend your patients. You can't just have them as your patient and really dislike them. You have to talk to them like they're your best friend. And sometimes you will make really awesome relationships with your patients, professional relationships, but often there are going to be very high maintenance, very difficult people that you still have to appease to. At the end of the day, I come home and after talking to about 20 to even over 30 patients a day, this can be very socially draining. And my boyfriend says, "Hey, you want to watch TV?" And I'm kind of socially drained for the day and I would like to sleep. But you really do have to have people skills. So I would say if you would describe yourself as more socially awkward, you don't really want to interact with people as much, this is not going to be the field for you. And I want to reiterate that this is a business. And with a business, to stay afloat, you have to consider your sales. You have to not just consider them, these are sales. And sometimes it depends on the legalities of the state, but you may have commission, so that may be really important for your income, but these are sales. This industry is sales driven. And I'm not saying that every person that I see I'm trying to sell them something. That's really not how it should feel, hopefully. I am trying to get them on a treatment plan that is going to benefit them the most and help them feel really good. This doesn't have to be sell, sell, sell. It shouldn't feel that way. But sometimes it can. Probably one of the most difficult things about this field is that when it comes to beauty, you're going to deal with crazy people. When it comes to the face, when it comes to beauty, people are going to be very specific and detail-oriented, I would say, and that's not a bad thing. I think I would be detail-oriented about my face too, but they are going to demand a lot because this is their face. And yes, when it comes to the face, people are going to get crazy. Very often when people are coming in for these beauty treatments that are medical treatments, they don't understand that the science is not exact. We understand a lot about it, and there's a lot of skills that you can do to make yourself the safest provider ever, but yet something can still go wrong, or a patient may not fully understand their expectations or outcomes with a treatment, which will really harm your relationship, the patient's opinion of your skills, the practice's skills, and aesthetics as a whole. And once again, this is a business, so you're gonna have people come in that will try to take advantage of your business. We've had people try to threaten us and say, I'm going to write a bad Yelp review if you don't give me a free filler. And that's really ridiculous, and I hate that people do this, but again, this is business. These are the downsides to business as a whole. Another downside that I would bring up is that it's not as much money as you think. Yes, aesthetic nurses walking around wearing designer because this is the beauty industry, but are you going to be making more than your friends working in a hospital? I can't really say. It depends on what you're making as a new grad. It depends on if you're making any commission. It depends on a lot of things, but I don't think that you're going to be making more than 6 figures in your first year if you have no experience. That's just my honest opinion. And that's pretty typical for a nurse. Now, just like any other field, as you get more experience, you should be able to make a little bit more, but you're definitely not going to be making millions working for someone as an aesthetic nurse. All right, now that I've scared you a little bit and driven off the people that have, decided, oh, that's one that I don't like, that's not gonna be for me, let's talk about how to make you stand out as an applicant. So our business most often uses Indeed. I'm sure there's a lot of other ways that we can put out ads, and other facilities will put out ads on different platforms, but I've worked with Indeed. Now, Indeed gives us the opportunity, or it gives applicants the opportunity to send in cover letters. And we want those cover letters. On the applicant side of Indeed, very often we are mass applying to any job we can, and we are saying, here's my resume, take my resume, and hire me. And your resume is not that valuable to me. Your resume is not that valuable to a dermatologist or a plastic surgeon. What's valuable to them is their business. So in a cover letter, you should be detailing why that practice needs you, or why you want to work for that practice. Now, this is a really good opportunity to brag about that practice. If I am hiring someone and I say, why do you want to work here? And you tell me, oh, I really like the beauty industry, I've always been into makeup. Great, that's every other applicant, get in line. But if I get an applicant who says, I really like what you did with the business, I really like your vision, I really like what you've created, your team is so valuable, yada, 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 I want you to brag about me, or I want you to brag about the business that you are applying to. And as easy as this sounds, I'd say many applicants that I've seen do not know enough about the business, and maybe that's because I know everything, or most things about the business, but a lot of people have no idea the practice that they're applying for, and that's kind of an issue. And for those who are hiring, that just tells us that you don't care. So tell us why you care so much to apply to us, and don't tell us why you would work for literally any med spa or any place that would pick you up to have you an aesthetic nurse injector or someone who's working in the beauty industry as a nurse. Again, talking about Indeed, we may ask for some questions to be answered. I'd say for most of the applicants that I've seen, about 30 to 40% of those who apply actually answer those questions. Some examples of questions that we ask are, when is your availability to talk on the phone? When are you looking to work? How many years of experience have you had in the industry? And very often we don't get detailed answers on here. If I see like a few sentences that seem genuine and that are not copy and pasted to every practice, that's very different. Follow the directions, answer the questions. If there are any other additional quizzes that the practice is asking you to take, such as a social media competency or a telephone screening, you should take them. Those applicants are going to stand out. The people who don't care are not going to take those. Now, the easiest advice that you can follow is just follow the directions. That is all we're asking. Answer the questions, submit a cover letter, answer the questions, take the quizzes. It really doesn't take too long, so please follow directions. If we get someone who doesn't follow directions, they are not going to be hired. Now let's guess that they allowed you to come in for an interview. That's amazing. Make sure when you walk in, you are very classy, you are very friendly. You go in and you talk to the people working there. Don't take up all of their time, but say, hey, it's nice to meet you. My name's Jasmine. To the patients there, if I had someone hiring who said, oh, you're gonna see Jennifer? Jennifer's amazing. You're gonna be so excited with your results. You're gonna love it. That's someone that I want to hire because they're already adding value to my practice and I haven't even hired them. Now back to being classy. This is a basic business interview tip, but make sure you are dressed to impress. Make sure you have nice, clean makeup, no over-the-top makeup, no over-the-top hair, no over-the-top lashes, you know. We really want to look classy. That's what this field needs to portray. That's what we need to portray to our patients. Now I want you to take a second and think, how are you going to stand out? As soon as you walk in the business, how are you going to impress the person hiring you? This is your chance to get really creative. If it was up to me, if I was applying to a practice that I was really excited to work for, I might bring in some Porto's cheese rolls, I might bring in some green juice if I think they're more the type to be on a diet, which often we are in the beauty industry, sometimes not. I like to eat everything that I see. Now the person hiring me personally, I would ask, what are your business goals? And I would write them down. That proves to the person hiring me that I'm really interested in helping them reach their goals. I'm really interested in growing their practice. I want to prove to be more of an asset than just an employee. But really, get creative here. They allowed you to come in to take some of their time to talk to them. This is your opportunity to shine. Get creative. This field is for creative individuals. Not saying that you can't be creative in other fields, but this is a great chance to shine. And lastly, think of everything from their perspective. From a hiring perspective, you want to think, what are their goals? Who are they trying to hire? What purpose are they trying to hire for? Usually when applicants come in, they're saying, hire me, I have these skills, but they don't think about the person on the other side of the table. So really think, and you can ask questions about what their goals are, what they're trying to accomplish by hiring you or hiring, what are they looking to get out of this applicant? Ask those questions. Those are all the tips I have for today. Thank you guys for watching my very first YouTube video. If you're seeing this on any other social media platform, I would highly encourage, give me a like, give me a comment if possible. I woke up at, I'd say closer to 6, which I know is not super early, but it's early for me. I'm really excited to be bringing you guys content about the industry and about the things that I find near and dear to my heart. So please subscribe, follow me, do all of those wonderful things, and I'm excited to bring you guys more content. Have a great day.